Welcome to the Oriental Medical Digest. When you're having an indigestion, vomiting may be the quickest answer. Indigestion is more serious than most people think. In Oriental medicine, indigestion, food poisoning, and diarrhea are collectively called as To Sa Kwan Nang. Acupuncture is often used in emergency cases, as inserting a needle can enhance the flow of energy to unblock the mess. Let's see how emergency cases are handled in Oriental medicine.
Oriental medicine regards indigestion as a condition where qi is blocked and stops circulating. When qi gets blocked by eating too fast, the usual signs are congestive feelings in the chest. For the diagnosis of stomach trouble and diarrhea, the physician first asks the patient if he has a diarrhea. Then he feels the patient's pulse by putting his second, third, and fourth fingers on the patient's 요골동맥, which is the artery passing through the thumb. The physician can find out the severity of patient's symptoms.
This patient is having indigestion from eating too fast. The usual symptoms are a tight feeling in the chest, a congested feeling in the inside, and frequent yawning. In Oriental medicine, indigestion is regarded as the result of blocked qi, and so acupuncture is applied. Blood is drawn from the qi-related 소상혈 to help qi circulation. 소상혈 is located on the inner side of both thumbs, where the horizontal and vertical edges of the thumbnail meet. Next, pressing down hard on the pressure points between the shoulder blades at the back can release blocked qi. By letting out blood, using the 소상혈, and by using pressure points in the back, acute indigestion can be treated.
After acupuncture comes medicinal therapy, where mixtures such as 향사양미탕, 소채환, 내소산, and 대화중음 are used. 향사양미탕 is used in cases where indigestion is caused by gorging on food after a period of extreme hunger. This prescription warms the stomach and strengthens the stomach and spleen. 소채환 is used for cases where food lodged in the body blocks qi circulation. This prescription helps qi circulation. Food poisoning is not a disease, but rather the name of the syndrome, and is an acute case of vomiting, diarrhea, and stomach ache due to food consumption. In Oriental medicine, food poisoning is called kwangnan, which has a wide range of meaning that includes acute gastroenteritis and cholera. In the West, when a patient has swallowed a chemical or poison, the doctor will usually give him a emetic or carry out gastric lavage. Antihistamine and steroids are injected for skin eruption and pruritus. Medication is prescribed to prevent dehydration from diarrhea. Oriental medicine divides food poisoning or kwangnan into two types. 건광난, where the patient has stomach aches without vomiting or diarrhea, and 습광난, where the patient alternates between vomiting and diarrhea. 건광난, where the patient can discharge the poisonous elements in his body through vomiting or diarrhea, is more serious than 습광난. For 건광난, the patient is given water boiled with ginger and salt to induce vomiting, and then given 곽향정기산 and 이중탕 after drawing blood from patient's 위중 and 십선혈. 곽향정기산 is made up of several herbs that neutralize the poison in sagi, remove moisture, enhance qi, and calm the stomach and spleen. 이중탕 is used to treat food poisoning caused by cold or unripe food. Ginseng, 감초, and Puncture warms the stomach and spleen and removes cold influence. When you have diarrhea from food poisoning, the cold influence in the body damages the stomach and spleen. This is when you should take 이중탕. For cold-induced 광난, the stomach aches can be relieved by warming the stomach. For heat-induced 광난, diarrhea is relieved by taking 오령산.
이 환자는 식중독 환자입니다.
Food poisoning is when the stomach and spleen are damaged by bad food. Besides medicinal therapy, Oriental medicine also makes use of acupuncture and Moxibustion therapy. Acupuncture is applied to the 합곡혈 between the thumb and forefinger and the 대충혈 between the big toe and second toe. 합곡 is related to the intestines and 대충 to the liver. So using these two 혈s helps the liver's detoxifying function and aids the discharge of harmful compounds from the intestines. Moxibustion therapy is used when there is serious diarrhea. A slice of ginger is placed over the navel and cauterized. This 혈 is called 신골. Moxibustion is also applied to a spot about 4 to 5 centimeters above the 신골 called the 수분. This 혈 is used to control moisture content in the body. In this way, acupuncture and Moxibustion therapy help cure food poisoning.
Eating raw food or food left for too long can cause food poisoning. Even people with healthy and well-functioning stomachs can invite trouble if they get lost in their thoughts or build up stress during a meal. To prevent acute indigestion, it is important to watch what you eat.
People with high sensitivity, weak digestion, and slow energy circulation are more prone to indigestion than others. Eating in a happy mood and controlling the pace and amount of meal may be the ways to prevent To Sa Kwan Nang. We'll continue with more emergency treatments next time. Thank you for joining us.